Assalamualaikum warahmatullahi wabarakatuh. Me, Nadia binti Sulaiman, and my teammate Izzah Atira binti Amiruddin will be presenting Electro-Ocular Graph for clinical operation. Okay, so what is EOG? Basically, EOG is a technique used to measure the electrical potential between electrodes placed on the skin that obtains signals from eye movement of a patient. This is the picture, which is the way electrodes will be placed on a patient's skin around his or her eye. We'll proceed to the eye anatomy. So this is a retina, the nerve layer lining the back of the eye. Retina senses light and creates electrical impulses that are sent through the optic nerves to the brain. Next, we have iris. Iris is the colored part of the eye which helps regulate the amount of light entering the eye. And then we have the pupil in front of the lens, near the lens. The pupil is the dark center opening in the middle of iris. The pupil changes size to adjust for amount of light available, smaller for bright light and larger for low light. Next, we have cornea. Okay, cornea is the clear front window of the eye which transmits and focuses light into the eye. It controls sharpness or clarity of an object.
The next one is myopia. Myopia is a condition in which the visual image comes to a focus in front of the retina of the eye because of defect in the refractive media of the eye or of abnormal length of the eyeball, resulting especially in defective vision of distant objects. It also can cause nearsightedness. So this picture shows the phenomena of myopia, which is image is formed in front of retina. The next one is hyperropia. Hyperropia is a condition in which visual image come to a focus behind the retina of the eye and vision is better for distant than for near object or farsightedness. So this picture is a phenomena of hyperopia, which is the image is formed behind the retina.
This is the table of difference between myopia and hyperopia. For myopia, an individual is able to see close or nearby objects, but not the faraway ones. So it is a nearsightedness, while hyperopia is someone is able to see faraway objects, but not the near ones. So it is a farsightedness. For myopia, the image will fall in front of the retina. Meanwhile, hyperopia, it is the image will fall behind the retina. Myopia it happens when eyeballs elongate or there is larger convergence of light by the eye. For hyperopia, it happens when eyeballs get shortened or there is lesser convergence of light by the eyes. The symptoms of myopia are squinting, headache, frowning, and blurred eyesight. For hyperopia, fatty eyes, headache, increased strabismus. So myopia can be corrected by concave lens, and for hyperopia can be corrected by double convex lens.
So we move to astigmatism. Astigmatism is a type of refractive error in which the eye does not focus light evenly on the retina. This result is distorted and blurred vision at any distance. Other symptoms can include eye strain, headache, and trouble driving at night. Astigmatism usually occurs at birth but can sometimes develop later in life. So this picture is show of normal version of eye and astigmatism version of eye. So for normal version, which is the cornea is in sphere shape and it has one focal point, and astigmatism which is oval shape and multiply focal point.
Okay, so this is for the terms that we need to know regarding EOG. So for electro-ocular graph, This is the instrument used to measure the voltage between two electrodes placed on the face of subject so it can detect eye movement. Meanwhile, for electro-oculography, this is the technique for measuring the resting and action potential of retina. And for the electro-oculogram is the signal result from the movement of the eyeball. EOG is commonly used at neurology department and ophthalmology department. This is the control panel of EOG. It is for accessories such as electrodes and monitor for display to be inserted. Okay, so there are two sides. The active, which is the positive side, is there are 4 channels, and for the reference sides, the negative side, there are also 4 channels and there are grounds. This is for type or model Metrovision, Blue Gain, KANDH or CAN KL730. There are 2 types of EOG.
The first one is routine EOG. The electrode of alcohol pad apply on the respective position on the eye. The electrodes record the electrical activities in voltage and differentiate the value between two electrodes. Electricity is not stimulated and poses no danger to the patient. The EOG recorded is computerized and displayed through the monitor. The next one is video EOG. Video EOG involves the use of infrared goggles to trace eye movement during visual simulation and positional change. The patient will be asked to follow objects that move erratically or move consistently or remain stationary. The eye movements are recorded and analyzed by the software. So we proceed to procedure of EOG. First, clean the skin on the cheek near the eyes. The skin should be cleansed of oil with alcohol or commercial skin preparing material. The next, attach large adhesive tape or micropore to the electrodes. Apply electrolyte gel through the electrodes opening. Ask patient to look straight ahead. Place the electrodes and press the electrodes onto skin.
Check on the impedances. Impedance of the applied electrode should be measured below 10 kilo ohms over a frequency range that includes 30 to 200 Hz. Next, we need to secure with tape. And if non-disposable electrodes are used, they should be suitably cleaned after each use to prevent transmission of infectious agents. Next, last but not least, connect the EOG electrode to the cable provided. The electrode leads are fed to the isolated amplifier in the interface panel. The output signal from this amplifier is sent to the analog digital board in the computer to be sampled. Human eye is an electrical dipole, and so there's going to be a potential difference that we can record when the electrode is being placed. When the eye is looking straight ahead, the waveform will be produced as this one. And when the eye is rolling eyes outward, the waveform will be produced as this one. And for rolling eyes downward is the third one, is this one. Cornea is the positive pole and retina is the negative pole. We need to know that eye movement generates voltage up to 16 microvolt and 14 microvolt per 1 degree in horizontal and vertical way. Positive or negative pulses will be generated. The amplitude of pulse will increase with the increment of rolling angle and the width of the positive or negative pulse, proportional to the duration of the rolling process. When the eyes are stationary or looking straight ahead, there is no change in potential and the amplitude is approximately 0. And last but not least, when the eyes are moved upwards, then results an action potential. the similar voltage with opposite polarities due to the left movement. Standard output waveform of EOG. EOG is based on principle of recording polarization potential or corneal retinal potential, also known as CRP. EOG signals ranges from 0.05 to 3.5 millivolt in humans and is linearly proportional to eye displacement.
This is the characteristic of EOG signals. First, the amplitude is relatively the same 50 until 200 microvolt. Second, the relationship between EOG and eye movement is linear. And the third one is the waveform is easy to detect. So this is the factor regarding the EOG signal. First, it does not fall in the amplitude or frequency range of the EMG signal. Second, EOG measurement electrodes are placed only near the eye region and thus no interference from EEG signal. Third, EOG is measured using precision electrodes and does not interfere with ECG signals. So this is EOG parameters, which is for frequency range DC to 100 Hz, signal amplitude 10 to 3500 microvolt, and typical signal is 0.5 microvolt.
Now we're moving on to the abnormalities of EOG waveform. So the subject or the patient is being tested under two conditions, which are lights off and lights on. So for normal EOG recording, this is the graph of EOG in volt versus time in minute. When the condition is dark, it is around here, and for the light, it is it will increase. The graph will increase the voltage. Meanwhile, for the abnormal EOG recording, this is the person with diseases, and the diseases are such as Amblyopia eyes, Best disease, lower EOG amplitude, and breaks-up of yellow spot in retina. The ratio will be much lesser than the normal person, normal eye, which are we can see here is the dark is much higher than the normal one, and the graph will be like this. Just now I did mention about amblyopia eye or lazy eye during the abnormalities of waveform. So now we're going to talk about the facts of amblyopia eye. Amblyopia is a decreased vision in one or both eyes due to abnormal development of vision in infancy or childhood. In amblyopia, there may be an obvious problem of the eye. Vision loss occurs because nerve pathways between the brain and the eye aren't properly stimulated. The brain learns to see only blurry images with the amblyopia eye even when glasses are used. There are two kinds of treatment that one can use to correct this problem. First, by correcting the refractive error with consistent use of glasses and or contact lenses. Next, forcing the child to use the weaker eye via patching or eye drops to blur the better seeing eye.
That was all from us. Thank you.